across Queensland. This brings the total to 2,297. 42 may seem like a relatively small number, but you will recall this is double the number we saw just 48 hours ago. So at a doubling rate, if this rate continues, we will see significant numbers in January as predicted. I have had an opportunity to speak to most of the doctors who've been looking after the patients with the diagnosis of COVID-19 in the last 24 hours, and I can say that all of the patients, with the exception of one, have minimal symptoms or no symptoms. The one patient who is moderately unwell and breathless in one of our teaching hospitals was unvaccinated. And it's disappointing to see that at this stage of the pandemic, the once in a 100-year pandemic, when every Queenslander has had an opportunity to get vaccinated, that we are still seeing unvaccinated patients being admitted to hospital with significant symptoms. But I wish this lady well, and hopefully she'll improve soon. At this stage, we have no one in intensive care in our hospitals. We are moving towards. You will be aware that previously we have been admitting all patients with COVID-19 to hospitals in Queensland, mostly for infection control purposes. We are moving away from that model, and we are clearing beds to allow capacity in the coming weeks should we require it. I can also tell you that information in the last 24 hours suggests that the Omicron strain is becoming dominant in Queensland, with 21 out of the 25 last tested viruses being found to be the Omicron strain. This is happening very rapidly, again, even more rapidly than we originally predicted. We thought that might take weeks. It looks like if this trend continues, it will be dominant within days. Omicron, as we know, is very contagious. It's the very contagious form of the virus, but it appears at this stage that the vaccine is very effective, particularly in preventing severe disease, which is the main thing. Most of the patients that we have seen who've had the Omicron strain, who are vaccinated, have very mild symptoms. We will, however, be getting more information as the days and weeks go past, particularly from overseas. So we still don't have all the information on that, and I don't want to overstate that, but the vaccines still appear to be effective. Our public health measures must, however, continue, and the particular reason why some of these measures, like isolating contacts, are important, because we want to allow particularly those that are vulnerable to get a third dose in the coming weeks, a third dose of the vaccine to protect them against severe disease. It's also important, some of our hospital workers, or most of our hospital workers, will have had their vaccine more than 5 months ago. It's also important that they receive a third dose, because we know that makes them less likely to acquire the virus and less likely to be infectious. And there have been now a number of events in the last few days where people working in the healthcare setting have acquired COVID-19. And this is inevitable because the virus is everywhere. The 42 cases that we've seen have been spread now again across the state, right down the east coast of Australia. The latest location, the latest city where we're seeing COVID-19 is Mount Isa. So it's not just the coastal cities that are affected, now it's the inland cities. So all Queenslanders must consider themselves potentially exposed, or that it is likely that most Queenslanders will be potentially exposed to this virus in the coming weeks, and our behaviour needs to reflect that. Obviously, we all need to get vaccinated. For the few of us that haven't received our first dose, please go off and get that first dose. But for those who are 5 months after receiving their second dose, it's a good idea now to get a booster, particularly if you're older and vulnerable. In terms of more information, we have 142 cases currently active. We completed 18,312 tests yesterday, 14,615 vaccines were administered in Queensland yesterday. mostly by Queensland Health, or that's by Queensland Health sites. Now, 89.53% of the Queensland population is double dose vaccinated and 84.22% single dose vaccinated. So we would expect the 90% single dose target to be reached sometime in the middle of this coming week.